marketed by the tobacco industry to get new people. And so they cherry pick from the medical literature and pick up the positive findings and then don't promote the negative findings. And so as a scientist, when there's conflicting research, my response ethically is I don't know. And so when you're trying to prevent adolescents from smoking, when you've got somebody driving around in a cool car passing stuff out and giving you freebies and they tell you this is 95% safer, and you've got scientists saying we don't know yet, it's more exciting to go with, well, this is safe and this is what is I'm reading all over social media and seeing videos on YouTube and Snapchat and all that kind of stuff. And so what else is in it? There's a wide variation of what we find in the aerosol. There's conflicting studies. We see all these mom and pop shops around town where they may mix their own juices. There's black market juices that include THC and CBD products now. There's a wide variety of the vaping things. And so if you get cheaper vaporizers, there's more likely to be nicks in the heating coil. So you're going to have more toxicants and you're going to have more heavy metal exposure. There's some that have 2 coils, there's some that have 1 coil, and so the different heat and the different function of your vaporizer can increase the amount of toxicants. There's differences in what you breathe in with a vaporizer compared to a cigarette smoke. And so the particulate matter of vaporizers is more concentrated and much smaller fine particles. And so the way our lungs work is if you think of a tree and then it branches and it branches and it branches and it branches, it goes to very small fine blood vessels at the very end. And so with that smaller particulate matter, it gets a much greater volume of surface area of exposure in the lungs. And so you also see when people switch from cigarettes to e-cigarettes, when they first start smoking to when they become a seasoned smoker, they change the pattern of how they vape, how deeply they inhale it, how long they hold it into their lungs. When they change devices, if they try and go from 6% nicotine to 3% nicotine, they will subconsciously change their smoking exposure to maintain the same level of nicotine exposure. And all those personal variations in how you smoke changes the way that the compounds interact on your lungs and where they get exposed to on your lungs. And all that, what does that mean for your cancer risk, for your emphysema risk, for your health risks? We don't know yet. We haven't been monitoring long enough. All right. So here are just some of the things that have been found in testing of the e-cigarette substances. A lot of names that don't sound like water. And so if I was an 8th grader and my friend said, breathe this in, it's just water, I'd be like, okay, that's not going to hurt me. If I was a 6th grader or a 7th grader or an 8th grader, it's like, oh, this looks scary. And so that perception of harm, they've done a good job marketing this. These are just some of the research on that. And so that 95%, I'm going to go back some slides. So when they talked about this 95% safer than traditional cigarette smoke, some of that's an estimate of when they do in vivo cellular studies. They take cigarette smoke and they blow it on these cells, and then they take vaporizer smoke and they blow it on those cells, and they look for DNA, RNA changes, inflammation changes, cellular apoptosis, all these things that are associated with cancer risk. And so this statement of 95% safer than that is from a few of those in vivo studies of cancer risk. And so kind of back to that, that still means it has a 5% cancer risk on those in vivo studies. And so if I change the way that I smoke to where my cells are exposed 1,000 times more frequently than the thing that caused 95% exposure risk, you're actually increasing your cancer risk. And so, and that over time we've seen increase of these in vivo cellular studies that have found e-cigarettes to have greater cancer risk than those initial studies. And they're in part because of all these different flavors that are in there. If you use different e-juice samples, you find increased cancer risks. If you use different devices, you find increased cancer risks. If you try and make a real-life comparison that fluctuates with actually the way that people vape in real life, you see increased cancer risk. And then if you take the fact, if you compare these studies where they're sponsored by the tobacco industry versus ones that are not sponsored by the tobacco industry, you see less cancer risk. There's a bias in the tobacco industry sponsored studies that shows less safe risk. And if we go back to our experience with tobacco cigarettes and the public health epidemic that we've seen with tobacco cigarettes, does anybody remember 1992 when the heads of Philip Morris and Camel raised their hands and swore before Congress that nicotines were not addictive and they did not cause cancer? And so it takes a long time to develop the epidemiological data that shows that kind of change in cancer risk and lung function risk. And so they're able to deny it. But part of why they were able to deny it for so long is they sponsored research to undermine the scientific research. And so the academic journals started banning nicotine-funded studies. And I've read some papers that, why did we give an exemption to nicotine-funded vaporizer studies? Well, part is this conflict between there may be benefit to this if we can get somebody to shift from smoking cigarettes to vaporizing. And so then there's a harm reduction model. So when you go back in time and you look at if they privately interviewed the tobacco scientists, they would tell you off the record, oh, we know it causes cancer. But if you go, it's not as bad today because a lot of the researchers think there's a benefit of this from getting people off cigarettes. But there's still an industry bias, and it's still an industry that has a track record of manipulating science, of downplaying the health benefits and downplaying the nicotine risk. So that reduction, the 9% to 450% numbers had to do with the individual toxicants that were in cigarette smoke. So some of them were 9% reduced, some of them were 450% reduced, and those were a bunch of the carcinogenics. But the big health risk, or one of the big health risks, is not reduced. That's just nicotine in general. We know it has health risks. There's other substances that are actually in the vaporizer that is not in cigarette smoke. Heavy metals are much higher content because of the heating coil element, and some of these have health risks associated with them. Here's a couple of those quotes. No tobacco-specific nitrosamines. And the tobacco-specific nitrosamines are the byproducts of heating nicotine that have the high cancer risk associated with them. Tobacco-specific nitrosamines, but at a 500 to 1,400-fold reduction. And so this is one of those quotes that I see over and over and over that promotes the benefit of it. And so I've read studies in preparing for this that when they look at secondhand exposure, kids that live in the home with somebody that vapes in the home have the same levels of nicotine and tobacco-specific nitrosamines from the passive exposure to the nicotine. And when you look at third-hand nicotine exposure, which is surface area, so if you go into the home of a smoker and they're not present, they have all this nicotine and these carcinogenic chemicals all over it. And so we find similar levels of the nicotine and the tobacco-specific nitrosamines on the surface area in people that vape. And part of the problem with kid exposure is because it's safe, all these people that used to smoke outside now come in and smoke inside, so kids that weren't exposed to these kind of things are now getting exposed to them in the home. And so this is a little bit about what I talked about. The majority of American health organizations have taken the stance there's too little evidence to make a statement that these are less harmful, and there's not enough evidence to begin advocating for a smoking alternative. While we've been waiting for the research, these have been aggressively marketed to our kids, and so we've seen this explosion in adolescents and college-age people. And there's some papers from experts saying it's likely, potential, promising that these are going to have health benefits. And so part of that, what's the evidence for the harm reduction paper? And so these are all things that we have case reports that we know that e-cigarette exposure can cause nausea, vomiting, headache, dizziness, choking, burn injuries, upper respiratory tract irritation, dry cough, dryness of the eyes, mucous membranes, release of cytokines and pro-inflammatory mediators, allergic airway inflammation, and these are on kids exposed to secondhand exposure to it. And so it does all that, but for a lot of these, the data shows it does it at a less rate than cigarettes. So the harm reduction model is if we know cigarettes massively worsen your kid's asthma, if you switch to vaping in the home, there's not as many kids that have the asthma worsening. This is an example of how those kind of statements get cherry-picked and pulled out. This is one of those in vivo studies. We can state that the exposure to e-cigarette vapors results in far less toxic than exposure to conventional cigarettes. If you get into this paper and you read this paper, they found that the combination of flavors and nicotine had about 80% the same cellular changes of associated with cancer as conventional cigarette smoke. This is just for the e-cigarette vapor without nicotine or without vapors had the smallest amount, but it still had pro-inflammatory changes associated with cancer. And so they make that statement and it gets publicized over and over and over again. So this emerging crisis, what's all this stuff going on in the news? Is anybody watching that stuff? All right. Anybody tell me what it is? No. We don't know. And so part of the problem is a lot of the products have been black market, so they don't know what they got, but not all of them. And so the most common lung illness is a lipoid pneumonia. Lipoid means fat, and so if we think of glycerin, and so your body breaks down glycerin into triglycerides and fatty acids and all that kind of stuff. And when you put some of the flavorings in, they're dissolved in oil. And so you're inhaling an oil that gets on your lungs, and you're not supposed to have oil on your lungs. And that causes this reaction in there that leads to a pneumonia. The other part, when you extract CBD or THC from marijuana, you make hash oil or you make a CBD oil. And so a large percentage of these products, or the black market products that have led to these, have been the CBD or THC vaping products. And so that should be part of the emphasis of what's going on in the news. But not all of them. Some of them had just flavorings, some of them had just nicotine. And so the CDC is looking at this and trying to figure out what the causative agents are. There's growing evidence that just the nicotine from the e-cigarettes has many of the same health effects. So one of the big problems with smoking while pregnancy is it increases your chances of having a small for gestational age baby. There's studies showing similar rates of at-risk babies to smoking traditional cigarettes with mothers that vape. There's case reports of babies being born with birth defects, and the only exposure was vaping. I've talked about the in vivo cancer markers. The newer studies are finding more markers of cancer, and there's the bias between industry studied or industry sponsored versus non-industry sponsored. So when I first presented this, one of the arguments was a less acute cardiac impact. And so a lot of what's been promoted as the 95% healthier benefit is based on lung function and cancer risk. So when we look at those in vivo studies that showed the 95% reduction in cancer changes, and then you look at if somebody is a heavy smoker and they switch from 100% to smoking cigarettes to vaping, they almost have an immediate improvement in their blood gases of oxygen level and how they feel and their lung function. And so a lot of the pulmonologists have written papers on benefits in lung function from switching to vaping. But if we look at the overall disease burden from tobacco cigarettes, the cancer risk and the COPD risk are each are a third of that. One of the big risks is the cardiovascular risk. So when you smoke, you lay down the atherosclerotic plaques, and then each time you smoke a cigarette, it increases your chances of having a heart attack or stroke. And so the newer data is that just the nicotine from the smoking has cardiovascular risks associated with it. And so heart attack rates for people that vape compared to people that don't are double. For traditional cigarettes, they're triple. And so that's a reduction in cardiovascular risk. And so for the people that are promoting, hey, if you've been a pack-a-day smoker and I can get you to switch and I'll reduce your cardiovascular rate by a third, that's a positive benefit. But for kids that have never smoked, starting something that doubles their heart attack risk is not good. And then if you use both at the same time, they're worse than either alone. It's more than additive, it's almost exponential. So it's combining the two together because you're getting both different exposures. And so these are some of the data. And so all this public benefit of if we could get smokers to change from smoking to vaping, we would have all these great health outcomes. What does the data say? Do people switch from smoking cigarettes to only vaping? Some people do. And so, but when we look at the evidence for it, the majority do not. The majority either stay smokers or they become what are known as dual users. And so if you become a dual user, that person wasn't able to smoke at work. Their wife wouldn't let them smoke in the house, so they went outside to smoke. And so now they didn't smoke in their car. And so now they smoke cigarettes in all the places they used to smoke cigarettes, but they also have a vape hidden in their office and take hits when nobody's looking. They vape in their car. They vape in bed at night. And so they may have cut their overall cigarette smoking from a pack to 5 to 6 cigarettes a day, or from a pack to half a pack, but they've also massively increased their nicotine load by doing both at the same time. And so when we look at the pulmonologists that say, hey, we see this massive improvement in lung function by getting people to reduce their smoking, the cardiologist and the cancer doctor know that you don't really change your cardiovascular risk until you get down to less than 5 cigarettes a day. And you don't really change your cancer risk until you reduce to a similar amount of cigarettes. And so while we are improving lung function, we're not making gains on cardiovascular health or reducing cancer risk by having all these dual smokers. And we found that the dual use of e-cigarettes and traditional cigarettes increases your cardiovascular risk. We don't have that cancer data yet, but I suspect we'll see similar things. Some of the studies show that the e-cigarettes actually had worse abstinence rates than other forms. And so there's mixed data. There's some studies where that have found e-cigarettes to be a helpful smoking cessation tool, but the majority find the dual smoke, this dual risk is what happens. All right. And so kind of back to that point of how we've been sitting on the sidelines waiting for us to have data to say this does harm. While that was happening, where this initially started as kind of an internet thing that was promoted by users and that was mom and pop shops, and so there was this kind of hippie feeling in the community. E-cigarettes have been bought out by big tobacco. They're aggressively marketing it. They're marketing it through internet and social media to the youth. And 95% of the ads make explicit or implicit health claims. They talk about smoking cessation, but they're not allowed to make these claims. It's against the FDA rules. They're not allowed to market on TV, so they've gone through all of this social media advertising. And so here's a statement from investment groups, and this is back from 2013. While we assume the secular conventional cigarette decline rate will hold, this could be moderated by two key reasons. People who would otherwise leave the category may be more inclined to stay given a better alternative. Dual use could drive increased usage overall, since cigarettes are allowed in many places where conventional smoking is prohibited. And so this is kind of big tobacco back to their old tricks of saying one thing when they promote the science, hey, this is a smoking cessation tool, this is going to have health benefits, and when they tell their investors, we know this is going to increase smoking rates. And so adolescents rates have increased 14-fold since 2011 to 2018. In 2011, the adolescents who had used within the last 30 days was 1.5%. The last Monitoring the Future study, the last 30-day usage was 27%. So almost a third of adolescents had used a vape within the last 30 days. Adolescents that vape are 4 to 7 times more likely to go on to use traditional cigarettes. And so since the 90s, when we had the big tobacco settlement, we've seen a decline in cigarette smoking rates across the country. That's happened in our teenage populations. And now the last year, this has started to go back up because those adolescents use vape nicotine, and a percentage of them go on to switch to cigarettes. And so we're seeing our smoking rates go back up. So we're starting to see studies that there is a gateway effect from e-cigarettes into other illicit substances. We've always seen a gateway effect where kids that smoke cigarettes are more likely to drink, more likely to smoke marijuana, more likely to use harder drugs. We're seeing studies that show a similar gateway effect with e-cigarettes. And so part of the problem when these came on the market, there was a big lawsuit versus the United States. The outcome of this lawsuit prohibited the FDA from regulating e-cigarettes like a medical device, and so that allowed them to make some of the advertising claims. It left this, because they exploded so fast, we didn't have federal legislation initially, and so states stepped in the back trying to make smoke-free zones, making it where you can't vape, where you can smoke. And so beginning in the 2010, states started making laws to prevent minors from getting it. And so Oklahoma passed our law in 2014, took effect November 1st, 2014. I trained the CIT officers on how to interact with mental health patients. And in 2015, when I did the talk, they didn't know it was illegal for minors to purchase these. And so it took a while for us to figure out they couldn't do it. And so one of the big problems with e-cigarettes is the way that kids use them. And part of the appeal is it is easier to mask your use of e-cigarettes. So when I was in high school, if you caught kids smoking in the bathroom, the principal could line you up and smell everybody's fingers and tell who was smoking the cigarette. It's harder to do that with e-cigarettes. And then if you put illicit drugs into them, it's easier to mask your illicit drug use. If you light up a joint at school, I'm going to be able to smell it. But if you're using e-cigarettes with illicit substances in it, it's easier to get caught. These are some drug forums where kids are talking about and sharing how to make the vape juice with drugs in them. And so this is some of the research we've done at the Children's Recovery Center. And so even back 2012, 2013, 2014, we're having over 50% of the kids admitted to CRC had used a vaporizer ever, and then our frequent use was over half of those that had used on a regular basis. And then when we talked about why they used it with flavorers, they own their own, and there was some that used it to try and quit smoking. These are names of the flavors. A lot of these sound like things that are targeted to attract kids to use. This is the percentage of kids that had used a marijuana product through a vaporizer. This is pre-Colorado legalization. This rate has increased. I haven't compiled the data on this from the past 3 years, though. That's coming up soon. These are quotes. I would do it across the street from Norman High during lunch in Plainview, and nobody would care that I was doing it. This was done. This kid told me they did it at between, what is that coffee? Starbucks and the gas station across from Norman High. I would vape it in the bathroom at school, and nobody would know because there's no smoke. I could stay stoned all day at school. They discussed multiple ways that they prepped it. These are the other substances that kids have discussed using and putting into a vaporizer to be able to use. In Oklahoma, methamphetamine is our most common thing that they talk about using in the vaporizers. Some PCP. If we were in different parts, it'd probably be heroin and OxyContin type. K2. Some of the reasons that they've gotten into it. Could do it all the time whenever walk around Walmart, nobody has a clue you're high. The flavors help cover up the taste. This flavor, Trump has just come out and talked about potentially outlawing flavoring. That's a big part of why kids are attracted to it. And when they do the internal testing of what you buy, we find that there's not a lot of truth in advertising. A lot of the ones that say they're nicotine-free, actually, when you test them, have nicotine in them. And then if you're sharing your vapes with your friends, you may still have nicotine residue from whatever they were doing before. And so kids can get exposed to nicotine even when they think they're using nicotine-free. The other part, now with our explosion of the cannabis industry, you can buy prepared cartridges that have THC in them. With the explosion of the CBD stuff that's supposedly legal, you can buy CBD packaging. There's also a lot of inaccuracy in the documentation of what you get in CBD products. There was a study that came out 2 weeks ago when they tested random samples of CBD products. A third of them had synthetic marijuana as the active ingredient. That's our spice in Black Magic. There's been two case reports in the last couple of months. One was a family that wanted to give their kid a CBD product because they had seizures, and they got one of these synthetic THCs, and the kid wound up in the ICU. Another kid got psychotic because it was the synthetic marijuanas rather than CBD in the vape. And so I know a lot of the kids are using the vaping, but they're also doing cannabis products in it. And then we have this big issue of the lung deaths are looking like they're predominantly linked to the THC in illicit vape products. I think we've got about 10 more minutes. I'll open up for questions if people have questions.
My son, unfortunately, he's 15, and all the kids, and I'm coming from Missouri, but he got into it last year, and we noticed an increased anxiety rate, all the effects of health that you mentioned. He got nearly suicidal, and however, the troubling thing is that in our school district, they're not as awake as Norman is, and they haven't addressed it, but then law enforcement's response has been very lackluster too, to go in when the 18-year-olds are coming behind the schoolyard or to meet somebody and say, hey, here you go, to get in and to shut it down.
Yeah, and part of that's, I mean, even in adults, there's the perception that these aren't that harmful. And so some of that downstream effect of us kind of thinking, hey, this is great, it's going to get people to quit smoking, well, it got all our kids to start smoking. And so that's why we need the prevention efforts that are being developed. Some of that anxiety may be nicotine withdrawal, and so some of it may be sometimes you get an illicit drug in the juice and you don't know about it. So.
That's the thing, they don't know what they're getting.
Yeah.
And then I found so many of the little, what look like flash drives, little bars.
Yep.
And it's terrifying.
How can you, is there a way to tell from just the vape if it has something other than just the juice in it? Like,
So
we gather lots of them, but we don't know what's in them. It's based on kind of their symptoms of how they're acting, and if they look like they've been.
potentially you could get one of those dipstick drug tests and put it in there and see if it comes up for it. That would be kind of a MacGyver type way to try and find out. But
And where do you get those?
they sell them at CVS now.
What, you just open the juice up and get the.
Yeah, pour it over the stick. I've done.
Half the time they're empty by the time we go.
Yeah. If you've got just the residue, it's going to be hard. But if you actually have the juice, you could do that. But if it's going to be the synthetic marijuanas, those are not going to show up on that kind of test. You could, are you in healthcare?
Yeah, I'm the nurse at Northern North.
Oh, okay. I mean, if sending it off to a lab, I mean, I don't know that you have lab access.
No.
So I can hear I don't vape because I know it's not good for people, but I was just going to ask, in Oklahoma, is it illegal for someone under 18 to vape?
Yes. It has the same rules as other tobacco. We passed that law in 2014.
I'm just wondering if there are any consequences. I know that it goes on in the bathrooms constantly, so
Oh, it
it
is.
seems like if there's no consequences, they're going to keep doing it.
Yeah,
And I think it's the same with cops. My husband's policeman. If there's no big consequences, they're going to keep doing it.
I assume the legal consequence would be a ticket. They're not going to send you to prison for vaping, or it'd be like if you got busted with underage cigarettes a couple of years. If there's illicit drugs in it, then there'll be more harsh crimes, but it's harder to tell. They'd have to have some kind of physical impairment for them to suspect something was going on, or if
Well,
they
that
were.
was, as of August of 2019, Governor Stitt just made it illegal to have vape products in the schools, and
Yeah.
that's across the board. But at the Norman North football game, one of the moms is vaping in the bathroom, you know, and
Yeah.
I'm like, do I say so? When does that go into effect, you know?
Yeah.
That are we gonna put up signage to say, like at the hospital I work at also, it says you can't vape or smoke on the property.
Our healthy living grantees can get more signage if you need more signage.
For the schools?
Right, and it is, if parents are not supposed to vape on school property either. Norman was actually a really early adopter of 24/7 tobacco-free before it was state law. And, you know, they've been very Johnny on the spot, but, you know, adapting really quick when the vapor thing hit.
Because that's what, I mean, I just feel like it needs to be made more aware that parents aren't supposed to do it either, because the
Yeah.
kids are seeing their parents do it, which then they think it's okay. And then the other thing, like she was mentioning, when they're taken from the students, because it's a law, because I actually went and talked to our SROs, our police officers, to ask them, when is Norman Police Department going to start issuing tickets to students? Because I would imagine after you get a couple of tickets, your
Yeah.
parents are going to start paying a little bit more attention.
I thought it wasn't in the City of Norman code yet, and it's gonna be added. So
Okay,
they're
that's
adding
what
it,
I
the
wanted
city
to know.
attorneys are gonna be adding it
Okay.
so that Norman police can issue tickets like that. The problem is, it's on the books as a state law, but unless you have a state law enforcement officer involved, they don't have the authority to issue that kind of ticket or, prosecute your kids. So City of Norman's working on it.
Yeah, if
That's what I
That's,
was
and I
hoping.
think
Have you-
that's what the kids get.
if you
Kids
think.
are telling them, I have a 14-year-old, they're telling each other it's not illegal. And maybe it's not in the city of Norman, but it's still illegal in the state.
Yeah.
It's just complicated.
A lot of school districts are actually fining the kids now. And, I mean, it can be significant fines, and it can be an escalating fine also. But once again, it kind of is that local control issue. You know, part of the problem is the way our state is, we have preemption laws, so we can't make these overarching laws. It has to be done through individual.
But the school districts couldn't do it until Norman did. Is that correct? Am I correct in understanding that?
Yes, I'm not quite sure.
Yeah, well,
I mean,
one thing, you know, that I would kind of speak to that point, talking about consequences and that kind of thing, there certainly are. And obviously administrators work through that with students. I think another piece to this, which is, kind of an event like tonight is super important, because we also know that, if we have individuals who are addicted, to nicotine, you know, I think, there's so much more to it. It's how do we work to support that young person, that adolescent who might be addicted, that we're kind of the idea you would have consequences, but you're not gonna punish somebody out of addiction. And so, try to finding ways as a district, right, to holistically support students, education on the front end, and of course the kind of healthy cessation processes that also work around. So definitely challenging.
Yeah, I think, you know, if we look back to what happened with cigarettes, I mean, my experience of walking around pre-92 to today, where you'd go into a restaurant and it would smell like smoke, you'd walk out the door and walk straight into other people's smoke. And so as we've had awareness of the risks, health risks of secondhand smoke, they've made all these clean air laws that you can't smoke within 20 feet of the entry. You can't smoke in restaurants anymore. And so some of that kind of non-smokers exerting their right to have clean, healthy air, to push it out of public places, and then you don't have kids seeing it. And so if we do some of those similar legal steps, and I don't want to say public shaming, but, you know, the way that smokers felt ostracized and had to take it away. Yeah. It's definitely much easier to hide.
Well, my son is communicated since we cracked down in the house and told him, if you do this, da-da-da-da-da, that, well, it cut my anxiety.
That's been the argument with cigarettes forever.
Oh, I know.
And so,
Tell him, no, it's not,
you-
you're hearing a bunch of malarkey.
there, I mean, some of it is, it's a deep breathing exercise to either smoke or breathe in a vaporizer. It's taking a break. So on this unhealthy behavior, we have superimposed relaxation techniques, coping skills. And so initially when you start do it, there may be actually, that is true, you're getting some anxiety benefit. And then you have the nicotine effect on your body that gives you this kind of dopaminergic reward path that affects your sense of being. But then you get to the point you're addicted to nicotine, and anytime you go into withdrawal, you have anxiety from withdrawal. So the use just eliminates the anxiety that the substance is causing.
Well, my son last year, he was so sick with everything, and we were putting two and two together, figuring it all out, that he missed like 19 days of school. And, you know, we could tell, okay, we could hear it, and then he was hiding it and doing it in his bathroom, and hiding it between under his bed, and you find him. And then you start to cough because it's going on in the bedroom.
Maybe time for one more question. We want to honor everybody's time and Dr. T's time as well. So one more question, maybe. Great job.
What do they know about kind of how long, like a half-life of that liquid in your lungs, the oil that's in your lungs? Does that stick around a lot longer than cigarette, the tar or the
So, you know, I don't know. Anything that's inhaled and delivered through that mechanism is going to have a short half-life. That's part of why you do it so frequently, is it wears off. And so you breathe it in and out. I don't know that there's a difference in your nicotine half-life based on whether you vape it or smoke it. Some of the some of it we don't know yet. We don't know what the long-term exposure to propylene glycol and glycerin are. With all these lipoid pneumonias, we don't know what the long-term chronic health lung effects are going to be of that. Some of the people that have recovered have regained function, but I don't know. When you look at some of the pulmonologists, when they compare the lung function tests of people that vape versus people that don't vape, they do see some changes over time, but it's not nearly as bad as cigarettes. And so how much of that's because the substance stays on your lungs and how long it stays on your lungs, I don't know.
A round of applause for Dr. And again, in conclusion, kind of the evening, if you ever have questions, don't hesitate to reach out. I'm certainly not the expert, but I can help get you to the folks in district if you ever wanted to talk more about it. We're so appreciative of being here. And Dr. Tankersley, hopefully, as a community, we took a little step just this evening on our time together that we're a little better educated, a little more informed. And if that, you know, we just keep doing that, take those steps one step at a time. Hopefully, we can be as proactive as possible as a district. So thank you all for coming and spending this evening with us.
Thanks. Okay, sounds great. You're a pediatrician?
I'm the medical director.
Oh, cool.
rubber mask.